Welcome to those of you who just got the notification on Facebook or LinkedIn or wherever you may be connecting from that we're doing a special announcement in how long? In just under 4 minutes. It's about female genital schistosomiasis. It is not about immunization, which has been the topic of most of our live streams, as immunization, vaccination is the largest program of the Geneva Learning Foundation. But here we're working with a number of partners who really have significant experience and expertise in FGS, and we'll be sharing about it. If you don't know about FGS, well, this is an opportunity to learn. And if you do know and are concerned about women's health more generally, we'll be discussing it discussing what this workshop is going to be about. And if you are from either Madagascar or Ghana, we have a special interest in you as a health professional with respect to FGS, and we'll be explaining that in just under 3 minutes. So we'll see you soon. If you're just joining us, we're about to share in just over 2 minutes an important announcement, an upcoming workshop on female genital schistosomiasis. So not directly related to immunization, obviously. If you follow the Geneva Learning Foundation's page, chances are that you're an immunization professional, but a very significant, very important health issue in especially for the 27 countries in which this disease is endemic, and especially affects women. So we'll be talking about it. Even if you don't work on FGS, join us. You'll learn a little bit about this important issue, and you're welcome to contribute if you already know. And in fact, if you're working in this, doing work in this area, whether it's as a nurse, a health worker, a doctor, an obstetrician, gynecologist, whatever the case may be. We'll see you in in a minute and a half. See you soon. Et pour nos amis francophones, ce sera à la demi. For francophone colleagues, on va faire la même annonce à la 30e minute. The same announcements in 30 minutes. See you soon. right, a warm welcome to you. My name is Reda Sadki. I'm calling in from Geneva, Switzerland at the Geneva Learning Foundation, here with Charlotte Mbu, who is having connectivity issues, but who's very much with us. How are you doing, Charlotte?
I'm doing great, Reda, and hi, welcome to everyone that's joining us for this live chat.
All right. And we're going to be talking about female genital schistosomiasis, and specifically how the Geneva Learning Foundation, working with partners from all over the world, including 2 countries. So you'll find out in about 30 seconds if your country is one of the 2 focus countries for what we're going to announce. We're talking about this workshop that is going to, in which we will be exploring female genital schistosomiasis with some of the world's best specialists on this issue. And then we also have some important updates about Friday's Teach to Reach Connect, as well as the Immunization Agenda 2030 course, which is really kicking off something that is relevant for the next decade. I want to, of course, acknowledge, let's see, we've got Shahid Iqbal from Punjab in Pakistan, who says, hi, everyone. And please do let us know, leave us a comment, tell us what city and country you are connecting from. Ahmad Navid Nusrat Shakar, also from Pakistan. Nasir Umar, from Katsina State in Nigeria. Jude Azai from Nigeria, hello back to you. And Martha Ngoing joining from Buea, Cameroon. All right, so where do we start? Let's look at so first of all, this is a reveal. We haven't shared this or announced this with anyone yet. So if you are loyally following us on Facebook, LinkedIn, YouTube, whichever of the Geneva Learning Foundation's social media channels you prefer, you are the very first ones to receive this information. We haven't announced this yet. So Charlotte, what would be your first question about this workshop? Where do we start?
So I think, Reda, we just start from the start. Why female genital schistosomiasis, and who should be concerned about this issue?
All right, so let's. So first piece of advice would be to really take your time to read through this announcement. We'll be sharing the link in the comments afterwards, so look for that. If you don't know the Geneva Learning Foundation's website yet, it is learning.foundation. And you can see here, first of all, it's one of the most neglected sexual and reproductive health issues in sub-Saharan Africa. There are 27, I believe, endemic countries. We're working with global experts on FGS. I am not, just as a disclaimer, an expert on this topic. We're helping to organize the pedagogy and ensure that there's an effective, supportive learning process. There's a large group of partners, what's called the FGS Accelerated Scale Together, the FAST project. Bridges to Development is an organization that we're working closely with, and they are one of the key partners in the FAST project. So that is first sort of bits and pieces of information. This is a preliminary announcement, so it is going to be updated soon. Let me take a pause to welcome Mercy Onu-Peters, who's watching from Nigeria. I'm glad you appreciate the topic and its importance. Dr. Emeke Kingston, also from Nigeria. So again, we warmly welcome Nigerian colleagues who have a strong presence today. Let's see. So first of all, if this is of interest to you, the first thing to note is the closing deadline. All right. And Charlotte, what tends to happen as we get closer to the deadline with our programs? What can you share about that?
Okay, so the general observation is that at the start, many people would be like, okay, I have enough time. The deadline is still far, so I'm going to wait till towards the end. And then you never know, towards that time, you start having connectivity issues and you may just miss the deadline. So as soon as possible, get on with the application process. And then you fill in the form, you submit it, and then you're sure that you are already set and among those who will be selected. So it's always avoid procrastination, the last minute rush, because it may end up turning against you. So basically, Reda, that is it.
Yes, indeed. And so April 9th is the closing deadline now. If you're watching or recording, this workshop may have been organized again and the deadline may be different. So always check the Geneva Learning Foundation's website. So how does the application process actually work? Just to cover that, you can see a big red button here, request the application. So you click on that and then you put your name. So I'm going to put my name here. Let's see, I'm going to put my email here and request the application. Now, you see, we first request your permission to send you email. And in fact, right after you submit your details, especially if this is the first time you're requesting information from the Geneva Learning Foundation, make sure to read through this. There is a request for your consent so that to authorize us to send you emails, that you do want to receive information for us. If you don't click on this link, you won't receive anything. So I'm going to go now. Let me see if I can. Let me see if I can go and find that invitation to apply. Right now, I'm only getting the French one. Let me see if it's in my junk mail. No, it doesn't look like it. So maybe sometimes it does take a few minutes, but this is the basic process. Once you get to this point, you want to ensure that our messages are not ending up in your spam. That's actually really, really important. We have some people who get really frustrated with that, but it's really that first step when you request the application. When you request the application, so it looks, for some reason it's not coming in immediately in English, but you'll get a message that looks like this with a green button that says click here to start your application. And so when you click on that, that will actually take you to, in this case, it's going to take me to the French language application, which is not what I want. You'll get taken here. You'll see your name. Make sure you see your name because it is a personalized link. You can't just grab the link and apply. And then I'd like to emphasize that the application, there are many questions you should budget basically 45, 60, maybe even 90 minutes to really do the application properly. I would suggest sort of going through the questions and then once you can sort of click through the questions, identify which ones are going to require you to compose your thoughts and maybe do that offline and then paste in the responses once you are ready to apply. All right, we have a couple more people who are joining us as well. Warm welcome to Franck Hilaire-Bété from Benin. And a question from Ahmad Navid Shakar, who says, have you analyzed this issue in Asia? So we'll be doing more live streams. I'm not going to answer that right now, but I encourage you to keep an eye on our social media platforms. So especially on the Geneva Learning Foundation's Facebook page, we'll be doing more live streams specifically on FGS ahead of the workshop. And of course, the best way to learn more is actually to join the workshop itself. All right, so that is, let's say, step one to sort of introduce the topic. One really important thing is if you are a health professional in a clinical setting, and you can see here the requirements, so take the time to read this, who performs pelvic exams in a schistosomiasis endemic country. You're a medical doctor, an OBGYN, a physician, a nurse practitioner, or midwife. Or you're a health professional who provides care, supports, or refers women and girls in an endemic country, but you don't perform pelvic exams as part of your work. In both of those cases, you are encouraged to apply. And here's the really important part is you don't need to have prior experience with FGS in order to be accepted into the workshop. And then as you scroll down and discover more about the announcement, you'll see here that there are two focus countries, and that is Ghana and Madagascar. So if you are from either Ghana or Madagascar, please let us know in the comments. We're keeping an eye on the comments in the chat. I also want to welcome Saidu Dahiru Dogua, who says, hello, everyone. Please, Saidu, tell us where you're connecting from, what city and country. We'd love to share that. And then Dofere Soro from Gabon. Pour les francophones, ça commence à la 30e minute, donc dans quelques minutes, dans 21 minutes à partir de maintenant. And just informing the francophones that the French language version will be doing at the halfway mark. And then Musa Bawa from Nigeria says, hi, everyone. All right, let's talk about Ghana and Madagascar. Charlotte, why are health professionals from Ghana and Madagascar especially encouraged to apply?
Okay, I think within the context of the FAST project, there is already ongoing work in these two countries, in some health districts in Ghana and Madagascar. And there is also, you talked earlier on about the partnerships that are going on. So we highly encourage professionals from Ghana and Madagascar to apply and take part in this workshop, because so many cases of women and girls in these two countries are affected by FGS. So it's very important that they should come and really get hands-on and current information as far as the diagnosis, the care, and the prevention of this disease is concerned. So that is why we are not discouraging other professionals from other countries from applying. Please do well to apply, but we highly encourage. And I'm happy today that we have with us, unfortunately we have lost him, Daniel Asomaning, that is the team leader for Scholar Alumni from Ghana. He was here with us. Surely internet connectivity issues caused him to drop. But basically, that's it, Reda. Thank you.
Thanks, Charlotte. All right, so what is schistosomiasis? In case you do not know this yet, as a health professional, if you work in African countries, you need to know more about it. Often it is neglected, it is undiagnosed, or even worse, misdiagnosed, underreported, and largely untreated, even though it affects, according to the World Health Organization, an estimated 56 million women and girls. And the suffering caused by FGS, one of the key messages for the workshops organizers, global and country-based experts who've been advocating in favor of making this neglected tropical disease less neglected. One of their key messages is really that the suffering of women and girls due to FGS can be reduced and even avoided. I'm now going to turn to Daniel Asomaning. Daniel, I'm asking you to unmute. I hope you have a decent connection today. I know you've already been dropped off, disconnected once. Are you able to speak to us? As Charlotte said, you are the team leader for Scholar Alumni in Ghana. We'd love to hear from you, whether you are an immunization professional, but that does not preclude your being interested in other other infectious disease which are not preventable through vaccines currently. So Daniel, no, it looks like Daniel's not going to be able to speak to us. All right, let's keep going then, Charlotte. What is your next question? Hello, Charlotte. Whoops, I've just muted you again. Let's get this... Let's work out. There are always kinks. Yes, tell me.
Yeah, okay. So I just unmuted myself, and I see Daniel has finally succeeded to unmute himself. So we can just... Hello? Yes, hello, Daniel. Good afternoon. Hello, Daniel.
Hello. Good afternoon.
Yes, Daniel, a warm welcome. There may be a delay of several seconds between the time when we ask you a question.
Hello, Charlotte. Good afternoon.
And when you're able to hear us. But please do introduce yourself and tell us, do you have you encountered or been made aware of the impact of female genital schistosomiasis for women and girls in Ghana, in your country?
Hello, can you hear me?
Yes, we hear you loud and clear, but there may be a significant delay before you hear us.
Yes, we can hear now, Daniel.
Yes. Please, Daniel, tell us, are you aware of...
Thank you very much. Yes.
What can you tell us about...
Yes. I'm very much... Yes, I'm Daniel Edwards-Mani. I'm a public health officer in Ghana with Ghana Health Service. And yes, female genital schistosomiasis is something that sounded very new. The first time I heard it, that was 3 years ago. It was a seminar on neglected tropical diseases. Schistosomiasis is among the group of diseases that we term as neglected tropical disease, just because it doesn't have recognition as other diseases, because it's neglected also because it affects mostly people who are really, in terms of the academic, the economic ladder, they are very low. So it's happening, just that we've not heard so much of it, just because the people it affects are people who have the leverage to really project their issues for you to come to the attention of people who make decisions. So yes, in Ghana, they are happening, though they are not so much widely spread as compared to other disease conditions. But yes, I know of it, and I know of some few people who suffer that condition. And it's mostly farmers or people who live in very rural and the remotest areas who are mostly affected by this condition.
Thank you very much indeed. Daniel Assomanning from Ghana.
Hello.
It is one of the 2 countries which are the focus countries for this workshop. Now, as Charlotte said, that does not mean that let me be clear, if you're not from Ghana or Madagascar, you can still apply and are still very likely to be included in the workshop. So I don't want to discourage anybody. The process for requesting the application is right here. Click on the red button. Make sure before you do that, you've actually taken the time to read the announcement. Just take it slow, take it easy, so you understand what this is about and determine if this is right for you. So that's it for this initial announcement. In the next couple of weeks ahead of the application closing deadline, we'll be doing some live streams right here, whether you're on Facebook, LinkedIn, YouTube, Twitter, wherever you may be, you will find us and be able to join us. We'll be inviting some of the global and country experts from Ghana, Madagascar, but also other countries who have really been advocates for women's health, specifically around this neglected sexual and reproductive health issue that affects a number, I believe it's 27 countries where it is endemic. All right, Dr. Derek Bofeko. Pour les francophones, on commence à la demi. And for Martha Ngoe, now she says we have so many schistosomiasis foci in Cameroon. So I hope that means the number of health professionals involved, but I am not entirely sure. So that's it. Before we go, I want to first of all offer a round of applause to those of you who have been following this live stream. That means we didn't announce it, or we announced it less than an hour before we went live. So thank you for being so great in numbers. And also, I want to remind you that there is more coming up. So first of all, you know that we're counting down the days to Teach to Reach Connect. So this is a unique opportunity. There's more than 1,000 immunization professionals from all over the world who are registered to meet, network, and learn. So that is happening Friday afternoon, Geneva time. If you're in the Asia Pacific, that means in the evening. If you're in the Americas, that means, that tends to mean in the morning. You need to request your invitation. It's the same procedure here. You share your name and your email, click on request invitation, then receive something in your inbox. So that's very important. You don't want to miss this. We'll be talking about 3 topics. This will be pure networking, so it's not one of those webinars where somebody drones on showing their PowerPoints. You actually get to meet fellow health professionals and just get to know them. Introduce yourself, they introduce themselves, and then you can talk about these 3 topics. We'll be having 3 successive sessions. Of course, that's a suggested focus, but you're free to discuss really any issues relevant to your immunization work. So that is what we're calling Teach to Reach Connect. It's to follow up exactly 2 months after the Teach to Reach conference that drew almost 7,000 national and subnational immunization professionals from all over the world. Next, also, if you are an immunization professional, last but not least, a reminder that the application deadline for this course from the World Health Organization is coming up soon. This is about the Immunization Agenda. So you may be hearing about the Immunization Agenda for the very first time. So click on the orange button. What is IA 2030? It is really the world's strategy for the next decade, from 2020 until 2030, to face the challenges of immunization. It was developed and adopted by member states before the COVID-19 pandemic hit, but it is absolutely relevant because it is all about adapting to the unknown, adapting to the complex challenges that are being faced by immunization professionals. There's also a very good website on the Immunization Agenda 2030. You can download the full document here, but it is intended as a living document. There's some major differences here with how the global community is approaching this new strategy, and it's about listening to you, listening to people in countries who are the ones in a position to make a difference with respect to this. With respect to the challenges that are being faced with immunization, including but not limited to COVID-19 vaccine introduction. So that is it for today. Very happy to be here and to have shared with you. Thank you so much for those of you who made it to this announcement of the workshop about FGS. So again, I want to go back. You'll find on the Geneva Learning Foundation's website, you'll find the information all about that. And I want to acknowledge last few participants who have joined on LinkedIn. So Michael Nwachukwu, all right, who says is really overwhelmed. Let me move myself out of the way. On your capabilities, even when it comes to digital learning on health issues such as immunization and vaccination works. Well, Michael, you're the one making a difference. We're trying to facilitate that conversation, that dialogue. Mercy Ono Peters, thank you. Mercy for being there. You're one of our most loyal fans following us on social media, always with good contributions. Amel is waiting for Teach to Reach Connect. We are too, Amel, indeed. And then Marta Ngoe says NTD versus COVID-19. Quite interesting. All right, that'll be the last comment for today. Thank you for having joined us. And then pour les francophones, on revient dans 4 minutes avec la version francophone de cette annonce. À tout de suite. Merci d'avoir été avec nous. Thank you so much, and we'll see you in a couple. And later this week, we'll probably be doing more live stream. Take care.